Anybody who's ever suffered a serious injury will tell you that physiotherapy is probably one of the keys to recovery. So it's only a matter of time before the same treatment was used to help our beloved family pets. Here to explain more about veterinary physiotherapy and the benefits it can have for your cat or dog is vet Andrew Byrne and physiotherapist Kate Plowman, and of course the star of the show, Bailey the dog. Good morning to you all. You were just saying to me there, Andrew, that has become really big business in the last 5 years, particularly abroad now, but it's coming here.
Yeah, particularly abroad in North America and the UK, they've recognised the value of physiotherapy in animals, which in a way it's really obvious because for many years people who suffer serious injuries require physiotherapy to rehabilitate and get their function back again. And in North America and the UK they've recognised this and have started to introduce physiotherapy to animals. Now there have in the past been some barriers because patient participation is very important in human physiotherapy. When we implement the physiotherapy to ourselves, and it's more difficult to figure out a way.
Well, it requires absolute cooperation from the patient, doesn't it?
You've got to be absolutely compliant. You've got to go home and do your exercises, and that's very difficult to do that with pets. And to some extent, I suppose, we've taken the easy option and ignored it for many years. And now we're realising, no, this doesn't work, and it's worth taking the effort to do it.
You can see the sense of it, but can I be cynical here and say, yeah, it's another way to fleece the customers?
No, it's for certain cases, and we take Bailey, for example. And Bailey was in a road traffic accident 8 weeks ago, and he sustained a serious fracture to his femur or thigh bone, this bone here on the model. And with simple fractures of the thigh bone, we'd normally repair these by putting in a plate internally, which will hold the bone very rigidly. And with this type of fixation, the dog will walk again very quickly, and you don't need to do physiotherapy. Their normal walking will do the trick. You needn't do anything else. In Bailey's case, his bone was shattered very badly, so we had to use what's called an external fixation device, or an ESF.
Looks like it's wrong for a coat hanger, doesn't it?
Yeah, it's like sort of a surgeon's Meccano. And what we do is if the bone is very badly shattered, in principle we put a minimal amount of metal in the bone. We use these pins above and below the fracture. And then there's a type of fixation device on the outside of R. Right. And in Bailey's case, you'll see he's a little bit more complex because he's got two parallel bars on the outside. He's got a pin that comes up through the cavity of his bone. So this device was to hold the fracture in place because it was very badly shattered. And this type of injury, the problem is that they won't use the leg again for quite some time. And when that happens, the bone will be okay because it's repairing. But our muscles react to stress, and if we don't use our muscles, they waste. And so you could do a great job repairing the bone, but because they don't walk in the leg for many weeks, the muscles waste and the joints get stiffened. So in these type of cases, it has to be done.
Okay. Kate Plowman, good morning. You're very welcome. You are a qualified physiotherapist, and you work in conventional medicine, hospital work in the matter at that time. So if I was sent there by my consultant or whatever, very likely that you would be dealing with me.
Okay.
How did you get from that to physiotherapy for animals?
I did a 2-year part-time master's in veterinary physiotherapy in the Royal Veterinary College in London. So I went over 1 weekend a month for 18 months and learned to apply my physiotherapy skills onto horses as the large animal template, and then dogs as a small animal template.
Is there very much difference in terms of sort of the engineering, the physiological engineering?
No, there's a huge amount of overlap between the human anatomy and the anatomy of horses and dogs. There are obviously some differences, and the physio techniques would change because of the muscle mass and the size of the bones often. But a lot of the techniques are very similar.
Basic principles are similar.
Yeah.
Andrew was mentioning there, cooperation of the patient is vital in good physio.
That's right.
Because if you don't do the exercises, you don't take the advice, then you don't heal properly.
Absolutely.
Very hard to get an animal to participate in that willingly.
Yeah, it is.
How do you get around that?
Well, cooperation comes from the animal's owner. And a lot of the time I will be teaching them to do particular exercises with the animal or to use particular electrotherapy devices. And as Andrew was saying, Bailey, when I saw him, he had some muscle wastage around his pelvis and his leg due to the fact that he was carrying it and he wasn't putting any weight on it when he was walking. So we worked with the Biomag, which is a type of laser treatment to help stimulate the bone growth in the clinic, and when I went out to do a home visit with Bailey, and when I've seen him in the clinic since. And also we used something called a muscle stimulator, which is very similar to TENS, which you'd often hear of used for pain relief, often in childbirth as well. So we had 4 different electrodes, and we placed these on the muscles that we want to stimulate, and
they send a pulse to them. It's almost like the sort of slender tone machines that people
That's
use.
exactly it. You get a little electrical current going through, and it builds up the muscle. So Bailey then started to put the paw to the ground a lot more comfortably, and he then started, after we finished 2 weeks of this, he then was much happier to use his leg, and he was starting to build up his own muscle mass then with his normal
And has he
state.
become more cooperative during the treatment?
He's been very good. He's
Well,
excellent.
he looks very placid and very loved and very pampered, it has to be said.
Absolutely.
Two things strike me very quickly, and we're going to have to wrap it at this. I see a lot of people watching this morning saying, that's a great idea, how can I get that for my pet?
Yeah.
And I can see a lot of other people saying, for God's sake, we don't have enough physiotherapists for humans in hospitals. This is one step too far.
Yeah, and it's true. People deserve the best of physiotherapy care, but also we take these animals into our homes and we love them, so why not give them some physio as well?
That's a fair point and a pretty irrefutable argument. So it's lovely to see you. Thank you very much,
Thank
Kate.
you.
Good luck, Bailey. And Andrew, thank you very much. We'll see you next week. Now,